The brachial plexus has 5 main branches and some other additional branches. The 5 main branches are the musculocutaneous nerve, the ulnar nerve, the median nerve, the axillary nerve, and the radial nerve. The musculocutaneous nerve is a mixed nerve containing sensory and motor axons. The musculocutaneous nerve is derived from the lateral cord. It leaves the brachial plexus sheath in the axilla at the level of the lower border of the teres major muscle and passes into the coracobrachialis muscle. It innervates the muscles of the flexor compartment of the arm and carries sensation to the lateral side of the forearm. As for the ulnar nerve, it is derived from the medial cord. The motor innervation of the ulnar nerve is mainly intrinsic muscles of the hand. Also, the ulnar nerve gives sensory supply to the medial side of the hand, that is the ulnar side, which comprises of the little finger and the half of the ring finger. The medial nerve is derived from the lateral and medial cords of the brachial plexus. It gives motor supply to most flexor compartments in the forearm and intrinsic muscles of the thumb, that is the thenar muscles. The sensory innervation of the medial nerve is to the lateral side of the hand, that is the radial side, which comprises of the thumb, the index finger, the middle finger, and half of the ring finger. The axillary nerve is derived from the posterior cord. It leaves the brachial plexus at the lower border of the subscapularis muscle and continues along the inferior and posterior surface of the axillary artery as the radial nerve. The axillary nerve serves as the motor innervation to the deltoid and teres minor muscles. These muscles act at the glenohumeral joint. The axillary nerve gives sensory innervation to the skin just below the shoulder. Also, the axillary nerve continues as the superior lateral brachial cutaneous nerve of the arm. The radial nerve is another main branch of the brachial plexus. It is also derived from the posterior cord. It continues along the posterior and inferior surface of the axillary artery and innervates the extensor muscles of the elbow, the wrist, and the fingers. The sensory innervation is to the skin on the dorsum of the hand on the radial side. Let's have a look at some of the additional branches. In addition to the 5 terminal branches we have talked about, there are numerous preterminal or collateral branches that leave the brachial plexus at various points along its length. We have the dorsal scapular nerve, the long thoracic nerve, the phrenic nerve, the subclavius muscle nerve, the suprascapular nerve, the lateral pectoral nerve, the medial pectoral nerve, the medial brachial cutaneous nerve, and the medial antebrachial cutaneous nerve. The dorsal scapular nerve is derived from C5 root just after it exists from the intervertebral foramen. It serves as a motor nerve to the rhomboid major and rhomboid minor muscles. As for the long thoracic nerve, it is derived from the C5, C6, and C7 roots immediately after their emergence from the intervertebral foramina. The long thoracic nerve crosses the first rib and then descends through the axilla behind the major branches of the brachial plexus. It innervates the serratus anterior. The phrenic nerve arises from C3, C4, and C5 root levels, although chiefly from C4 nerve roots. It crosses the anterior scalene muscle from the lateral to the medial and extends into the thorax between the subclavian vein and artery. The subclavius muscle nerve, or the nerve to the subclavius, is a small filament that arises from the upper trunk. It descends to the subclavius muscle in front of the subclavian artery and the lower trunk of the plexus. Suprascapular nerve is another additional branch of the brachial plexus. It arises from the upper trunk, which is formed by the union of the 5th and 6th cervical nerves. It innervates the supraspinatus muscle and the infraspinatus muscle. It runs laterally beneath the trapezius and the omohyoid, and then enters the supraspinatus fossa through the suprascapular notch below the superior transverse scapular ligament. It then passes beneath the supraspinatus and curves round the lateral border of the spine of the scapula to the infraspinatus fossa. Lateral pectoral nerve arises from the lateral cords of the brachial plexus, from the 5th, 6th, and 7th cervical nerves. It passes across the axillary artery and vein, pierces the coracoclavicular fascia, and it is then distributed to the deep surface of the pectoralis major muscle. It sends a filament to join the medial anterior thoracic and forms with it a loop in front of the first part of the axillary artery. The clavicular head of the pectoralis major muscle is innervated by the nerve of the medial pectoral nerve, arising from the medial cord from the 8th cervical and 1st thoracic nerve. It passes behind the first part of the axillary artery, curves forward between the axillary artery and veins, and unites in front of the artery with a filament from the lateral nerve. It then enters the deep surface of the pectoralis minor, where it divides into a number of branches which supplies the muscle. Several branches from the medial pectoral nerve pierces the muscle and end in the pectoralis major, which supplies the muscle. The medial and lateral pectoral nerve often join together to act as a single nerve, innervating the pectoralis major and minor muscles. The medial brachiocutaneous nerve is the smallest branch of the brachial plexus that arises from the medial cord. It receives its fibers from the 8th cervical and the 1st thoracic nerves. It passes through the axilla, at first lying behind and then medial to the axillary vein, and communicates with the intercostobrachial nerve. The medial brachiocutaneous nerve descends along the medial side of the brachial artery to the middle of the arm, where it pierces the deep fascia, and it is distributed to the skin of the back of the lower third of the arm, extending as far as the elbow, where some filaments are also lost in the skin in front of the medial epicondyle, and others over the olecranon. It communicates with the ulnar branch of the medial antebrachial cutaneous nerve. This nerve supplies the lower medial portion of the arm. Another additional branch of the brachial plexus is the medial antebrachial cutaneous nerve. This nerve arises from the medial cord of the brachial plexus. It derives its fibers from the 8th cervical and the 1st thoracic nerve, as its commencement is medial to the axillary artery. It gives off near the axilla a filament that pierces the fascia and supplies the skin, covering the bicep brachii nearly as far as the elbow. The nerve then runs down the ulnar side of the arm, medial to the brachial artery, and then pierces the deep fascia with the basilic vein about the middle of the arm. It divides into two branches. Let's talk about the blood supply of the brachial plexus. The brachial plexus is supplied mainly by the subclavian artery, although other vessels that are involved are the vertebral artery, the ascending artery, the deep cervical artery, and the superior intercostal artery. The cords and the rootlets of the cervical nerves are supplied by the anterior and posterior spinal branch of the vertebral artery. The trunks of the brachial plexus are supplied by the muscular branches of the ascending, the deep cervical, the superior intercostal, and occasionally by the subclavian artery itself. Many variant forms of the brachial plexus do exist, with none representing most patients. Care catalogued 29 forms of the brachial plexus among some 175 cadaver specimens that were dissected between 1895 and 1910. In the early part of the 21st century, one author described a total of 38 variations of the brachial plexus. Up to 53.5% of the plexus in cadaver studies possess significant anatomic variation from the classic description of the brachial plexus. Two notable variants are the prefixed brachial plexus and the postfixed brachial plexus. The prefixed brachial plexus, which can also be called the cephalic or high brachial plexus, occurs when the C4 ventral ramus contributes to the brachial plexus. Contribution to the brachial plexus usually commences from C4 to C8. The postfixed brachial plexus, which can also be regarded as the caudal or the low brachial plexus, occurs when the T2 ventral ramus contributes to the brachial plexus. Contribution to the brachial plexus usually comes from C6 to T2. In the next video on the brachial plexus, we'll talk about the lesions and some diagnoses related to the brachial plexus injuries. Don't forget to subscribe and share. See you in the next video.